Minor sign. We're going to ask the patient, can you please stand up? Positive sign would be difficulty standing up, which indicates a variety of lumbosacral, sacroiliac, or sciatic nerve problems. Bell test is the test that is going to help us differentiate a low back pain coming from the sacroiliac joint or low back pain coming from the lumbar spine. First thing we're gonna do is ask the patient to touch your toes. Can you move forward and touch your toes? And then straighten up. The next time we are going to restrict the sacral movement using the sacroiliac. We stand next to the patient, and can you bend forward, please? If he had pain under both conditions of the test, it would indicate a lumbar spine problem. If he only had pain during the first condition of the test, it would indicate a sacroiliac joint problem. Lumbar spine test. This is the Valsalva maneuver. It's a test for the presence of space-occupying lesion, exacerbation, compression of the nerve root. Can you please take a deep breath and in and bear down? Okay. Relax. Positive would be radiating pain from site of lesion, indicates nerve root entrapment by disc lesion. Once we have established that the patient has a space-occupying lesion, we need to establish what level that lesion is located. Heel walk test. Can you walk on your heels, please? Positive would be inability to perform test, indicated L4 disc lesion, which is putting pressure on L5 nerve root. Now we're going to do toe walk test. Can you walk on your toes, please? Okay, you can relax. Positive would be inability to perform test, indication L5 disc lesion encroaching or putting pressure on S1 nerve root. I'll be performing the Kemp test. Can you cross your arms on your shoulders, please? I'm going to laterally flex the patient, stabilize the opposite PSIS, and I'm going to bring him into rotation and then extension. Okay? And then on the other side, rotation and extension. Okay. If the patient experiences an increase in pain when leaning towards the affected side, it would indicate a lateral disc bulge. The patient experienced an increase in pain when leaning away from the affected side, it would indicate a medial disc bulge. And if the patient experienced local pain, it would indicate facet pathology, myospasm, or muscle strain. Straight leg raise test. We're going to bring the affected leg up to a point of pain or 70 to 90 degrees. Positive would be pain in the posterior thigh, indicates sciatic radiculopathy or tight hamstring. Possibly discogenic sciatic radiculopathy, which means we have a disc bulge compressing the nerve roots that make the sciatic nerve. Braggers test. If we raise a straight leg raise test and we have an unclear positive, we bring the leg up to the point of pain. Then we drop down 15 to 20 degrees, and then we dorsiflex the foot. This will reproduce the pain or reproduce the stress in the sciatic nerve without reproducing the same stress at disc level on the hamstring. Positive sign is reproduction of posterior thigh, and then the indicative will be sciatic radiculopathy. Sicard sign. We raise the patient's leg up on straight leg raise test to the point of pain, and then bring it down 15 to 20 degrees, and then dorsiflex the big toe. This has the effect of stretching the medial plantar nerve, reflect into the tibial nerve, into the sciatic nerve. Positive would be reproduction on sciatic pain and indicates sciatic radiculopathy. Leaner sign is familiar to Burmese, Bradinsky, and Soto Hall. It involves neck flexion. In this case, our positive sign is radiating pain down the posterior thigh, indicating sciatic radiculopathy. This would be an extreme case of sciatic radiculopathy. Terrain sign is another test for extreme case of sciatic radiculopathy. What I'm going to do is dorsiflex the big toe, pulling on the medial plantar nerve, which pulls the tibial nerve, which which pulls the sciatic nerve. This reproducing the sciatic nerve complaint would indicate sciatic radiculopathy. This extreme or severe case given, we don't even have to raise the patient's leg in order to reproduce the finding. The bonnet test. I'm going to take the patient's leg and then internally rotate it and adduct the hip. This has the effect of stretching both the piriformis muscle and increase the length between the sacrum and lumbar spine, where the sciatic nerve would come from, and the neck of the femur, which they have to wrap around to get to the back of the leg. I'm going to do a straight leg to the opposite of the shoulder. Our positive sign would be reproduction of posterior thigh pain, indicating sciatic radiculopathy or piriformis syndrome. And indicates of piriformis syndrome, what we would expect to see is almost instant pain getting into position as the piriformis is stretched over the sciatic nerve. Well, leg raise test. If we assume our patient has left sciatic pain, I'm going to raise the right leg up. Positive would be reproduction of pain on the left leg that will tend to indicate medial disc bulge. If raising the right leg reduces pain on the left leg, it would indicate a lateral disc bulge. Femoral nerve traction test. Can you tuck your shin as far as you can go? Okay. Now I'm going to flex the knee and then extend at the hip. Positive would be pain down the anterior thigh, indicating entrapment of the L2, L3, and L4 nerve root. To nail foot sign, we're going to tap behind the medial malleus where the medial plantar nerve wraps around the foot. So medial malleus. Positive would be pain in the fourth foot, specifically in the big toe, second toe, third toe, and medial half of the fourth toe. Indicates tarsal tunnel syndrome. Morton test. We're going to approximate the metatarsal heads by squeezing together, and positive would be pain between the metatarsals, indicates metatarsalgia or neuroma.